Let's now look at how the patient narrative forms the foundation of clinical medicine. In general, a patient encounter starts with the patient telling the physician a narrative about their health concern. And in this way, it is correct to say that the patient is the primary author of the clinical narrative. And to be specific, this is a first person narrative. In their narrative, the patient describes their health, highlights the aspects that they perceive are concerning, and skips over those parts that they perceive as unimportant. The expressions used by the patient and their pacing is all up to the patient's imagination. Now, when interpreting a patient's story, the expert clinician will pay attention to all aspects of this patient's firsthand narrative. They figure out who is the narrator, where do they live, what are the social circumstances they live in, and in particular, what key words, expressions does the patient use in telling their story. And it's not uncommon for patients to present their own unique narrative, but to overlap the aspects of their narrative with classical patterns that hundreds of other patients before them have used when telling a story of the same condition. My impression is that expert clinicians, having watched some of them, that they sit and listen to the patient tell their story from start to end. They don't interject to ask questions during the story, as this might bias the story. And they do not put much weight into the clinical notes of other clinicians who have tried to copy down the patient's story in their own form. For them, listening to the patient tell the medical story in their own words is one of the most important parts of arriving at the differential diagnosis. It seems that the narrative whole of the patient's story is valuable. The story the patient presents is often flawed from a medical perspective. It probably leaves out key details and includes many superfluous details. But this doesn't matter, as quite often these trends are similar among patients. And in this way, the narrative the patient presents is the most original form of data. Interestingly, it also seems that expert clinicians are often able to assemble a better understanding of the patient's condition and potential diagnosis, especially if it's a tricky diagnosis, from a rambling first-hand patient narrative than from a series of answers that the patient might provide to discrete specific questions posed to the patient. This is an extremely important point, and we can discuss it in a future post separately. One extremely experienced physician that I was watching with a patient who had a complex and undiagnosed presentation said that directly to the patient that he had not heard of another patient in his career tell a story like theirs before. And this strongly reflects this master diagnostician's approach to his diagnostic reasoning. Having carefully listened to what the patient had to say, he compared it to over half a century of stories that he had heard from patients to assess for overlap. However, the patient's firsthand narrative rapidly becomes contaminated. This is not necessarily good or bad, but it's really just how medicine is. The patient may discuss their condition with their family or friends. They may spend time researching on Google. The physician or other clinicians will start to ask probing questions of the patient, and of course we begin to ask the patient to clarify certain parts of their story. Each time the patient tells the narrative, it morphs and changes. The patient's choice of words slowly morphs away from their natural lexicon into using medical terms. The patient starts to emphasize parts of the story that they were initially had no concern of or of interest, but that came up repeatedly on questioning, and then this gives the patient the impression that those particular details might be important. Although second reflections upon an event or a narrative may uncover details that were initially forgotten, it is also equally possible for aspects of the patient's narrative to morph, embellish, or change with each subsequent retelling. The evolution of the patient's original narrative is just the nature of medicine. Physicians are typically skilled enough to understand if they are listening to an original raw narrative patient story or a patient narrative that might have evolved with time. And this is not to suggest that physicians don't believe patient narratives that are retold, but they weigh the word choice used and not used by patients slightly differently depending on how unadulterated the narrative is. This process of adapting our interpretations of the first-hand narrative to the situation is rather opaque in medical diagnostic reasoning and extremely difficult to quantify within a coded diagnostic algorithm or a computer system which might be trying to capture physician diagnostic reasoning. And so to conclude, the start of the patient encounter generally involves the very words used by the patient to tell their first-hand narrative of their health. This original first-person narrative is both invaluable and generally unreproducible. The start of the patient narrative involves these very words, but it rapidly is influenced by subsequent questions the clinician asks and slightly changes upon each retelling.